So again, good afternoon, everyone. Thank you for joining our standing training for October. Today we'll be covering the immunization setup and maintenance. My name is Lori Bergen, Senior System Optimization Specialist on the Health Solutions team. So on our agenda today, we're going to talk about immunizations e-encounters, some practice parameters, default e-encounters, immunization orders, provider preferences, vaccine manufacturers, vaccine admin sites, as well as we'll take a look at the overview of the visual concept of our best practice of setting up your immunization schedule, parent labels, alternate labels, schedule types, vaccine alternates, vaccine information statements, default diagnosis, and we'll take a look at the CDC website. So the first thing that you want to do, now all of our centers have been live for quite some time now. So most of the things that we're already going to be talking about today, you should have set up. And if you don't have set up, we highly recommend that you go back through, if you didn't have an e-encounter for your immunizations, to go ahead and set that e-encounter up. If you don't have your parameters set up properly, take a look at them, make sure that they're set up as far as what we're talking about on this presentation today. What we don't want you to do is, after this presentation today, start going in and changing your current pediatric schedule, your current adult schedule. Because what that will do, it will affect your users as they're using it. So as we go through this presentation, I'll bring up points of maybe when you should be doing updates to your immunization schedule, whether you should create a whole new one and then train the staff and then roll it out. So those are just some key points that I want to make sure that everybody understands, not to affect your workflow. So creating an e-encounter for immunizations is for the administrative fee of your immunizations. So to go and check to see if you have an e-encounter or if you have to update that e-encounter, you would go into Practice Admin, Formats, Favorite Procedures, and Diagnosis List. Now, you do have to have security rights to go into Practice Admin in order to look at these e-encounters. So once we get into the e-encounter itself, what you're going to do is click on Favorites, then you're going to click on New, and if you see here, there's a favorite list called Admin Charges. Well, what I'm doing is I'm showing you, if you do not currently have one that's called Admin Charges or Immunization Admin, when you click on New, you're going to name the actual code, which will display here in the favorite list, and then what the description is, which will display here in our description. Once you're done, you'll go ahead and you'll click on Save. The next thing that you're going to want to do is click on your procedures list. When you click on the procedures list, you're going to want to click on New and then name your procedures list, Immunization Administrative Codes. When you click on Add, you will go out and find your 4 or 5 different administration codes that you use for immunizations. So administration of a single vaccine, administration of a subsequent vaccine, if it's an administration of an oral vaccine, etc. And if the person that is setting up these e-encounters are not familiar with the admin codes that they need to add there, I highly suggest that you work with your billing department who would know these codes and could supply these codes for you, so when you go to add them, you make sure that you're selecting the proper codes. Once you've added those codes, you'll go ahead and save. So once we've added our diagnosis or our procedures list, we're going to come back to our favorites list. Once you go to the favorites list, that you have in focus here, we're back to our administrative charges favorite list. I would click on edit, and then I would click on my procedure list tab. You're going to have multiple lists of procedure codes here because e-encounters are used also in orders and charges in EHR. But for this particular one, we're just doing it for the immunizations administration charges. So I named that list immunizations. So once I find that list, I click on it, and now I add it. So now it is attached to my favorite list. This is the list name, and these are my codes that are going to be available for selection when I administer an immunization. Once you're done adding that list, you can go ahead and hit save. Now, if you go in and you already have your list, what happened a long time ago is that on the admin charge or the immunizations admin charge, whatever you labeled it, you can come into your favorites, you could find your list, and then take a look at what you have here. Some people added many, many codes to their administrative charges, but they don't need it. They did not need all of the immunization codes on there. They just needed the administrative fees on there. So you might want to go back and clean it up. Once you've created your e-encounter list, or you have your administrative e-encounter list already created, it's just got your admin fees in it, you would come back into Practice Administration and then go to Practice Configuration, which is the little cog wheel. Again, you will need security in order to access Practice Administration. Once you get in here, if you're highlighted on the parameters and you just type in IMM, what we're looking for here is procedure diagnosis favorite list for immunization admin charges. If yours does not have anything here, you would want to double click and find the list that you created and attach it here. This way, when your staff is administering vaccines, once they have administered the vaccine, the next page that will pop up is the administrative charges list, so that they don't have to go into orders and charges and then find those administrative codes in order to drop them. Once you've added your list here, you'll go ahead and hit save, and then it will start to default for all of your clinical staff that is administering vaccines. There are a lot of other parameters in here, but we're not going to go through every single one of the parameters. This is one of the most important ones. I will mention the one that's underneath, require encounter location for immunizations. If you are on the registry, so any of our people that are on the call from New Mexico, any of our centers that are on from St. Louis, as well as Rhode Island and Florida, you're all on registries, and an encounter is always required when you administer vaccines, okay? This should already be set to yes, but if your MIS department is in here, make sure that your list is defaulted as well as the encounter location for immunizations if you are on the registry. Okay, sorry, my screen is going forward too many times. Okay, so the next thing we're going to talk about is your order setup for your immunizations. So if you're in EHR and you go underneath your orders tab, you should have a tab for your immunizations. So when your providers want an immunization given to either your pediatric patient or your adult patient, they are ordering that and sending it to their MA or their nurse to administer that vaccine for that child. So in order to get to order setup, you're going to be in EHR, you're going to go to setup, and you're going to go to orders. Now you do have to have security rights in order to get in the order setup. Again, most of you should already have an immunizations order tab, but I want to show you how to create it if you do not have it, and or go through and update your immunization order tab and clean it up so that it follows the standards. So in order to create a new one, you're going to click on New Order. Then you're going to type the description, which my description, I'm going to say that it's just DTaP. I want to make sure on these order setups, and when you go in and review your order setup that you already have today, that it's very, very generic. I don't need to say that I have DTaP and I have Pediarix and I have all of these different types of combos, because the providers don't necessarily know what you have in stock. All they know is that this child or this adult is due for this vaccine, and that is the vaccine that you need to order for them, okay? When the order actually gets to the MA or the nurse, they are very familiar with what they have in stock, and they will administer it per what they have in stock on the immunization schedule, okay? So once you've added your description, you'll go ahead and click Save. So as I mentioned before, be very, very generic on your naming convention. If you have all of these different ones, Pediarix, Kinrix, you may not have that in stock. So just actually, the name of the vaccine is perfectly fine, okay? So what I did is I went in, so here's my new order tab for immunizations, my new type, and my new orders. So I have my DTaP, my flu shot, my Hep B, my MMR. Another thing that you want to take a look at, if you already have your immunization tab set up, I'm going to go back one screen, is post procedure to post for order. It is not standard practice to actually to put that procedure code on the order itself. The reason why is Dr. Lori is now going to order a DTaP, an MMR, and a Hep B for little Johnny. Well, my MA Jennifer is going to go in, and little Johnny's mom is going to say, I don't want that Hep B. When my MA Jennifer goes in to close that order, if you have a charge posted on this order, it is going to drop a charge for a vaccine the child did not get or the adult did not get. So it's not recommended to put the actual charge here on the order. Very generic. The provider is ordering it, and then the MA or nurse will be the one to administer it. Once you're done repeating this step by putting all of your new orders underneath your subtype of immunizations, you can go ahead and you can close this window. Now, what you could do, if you didn't want to clean up the tab that you have today, if it's got extensive information and you did not want to go in and change all of the stuff, you could create a brand new type. You can't name it the exact same convention, but you could create a brand new tab. And then once you're ready to roll it out, you could deactivate your old tab. So that way, all of your providers would know this is our new tab that we're going to use. All of the clinical staff would know, even though they're commonly not going in and ordering things, but they would know that this new tab has been created and we're using this tab moving forward, and then deactivate the other tab. General preference. So when you are in EHR, you will go to preference and you will go to general. Now this is for our providers on the call, because if you're a user, you cannot go in and set this parameter. So for our providers, you would go in and go to general, click on your immunizations tab, and then here you would say, which schedule do I want to default to for children, and which schedule do I want to default to for adults? Everybody should have this set up today. But if we're going to go through and we're going to do a massive cleanup on our orders, and we're going to do a large cleanup on our immunization schedule, then this schedule may change, the schedule name. Okay, so just make sure when we go through these next steps of showing you how we recommend to set up your immunization schedule, I say the same thing for your orders tab as I would for your immunization schedule, is to create a whole brand new one. Let the staff use the old one as have you been using it currently, and then when you are ready to roll it out, you would roll out your new orders tab and you would roll out your new immunization schedule, reminding all providers to come in and make sure that they have the right schedule in focus. Okay? Once you've added that, go ahead and click Save. So any of you that have gone up on the registry and have worked with me on these registry projects will know very well these next steps that we're going to go through. These steps often get missed at our centers. Manufacturers are like stores. They can be in business for a very long time and then no longer make a particular vaccine or don't make vaccines at all. And then the centers just leave them out there as active, causing errors because then a staff member, if it was used 2 months ago on an administration of a vaccine and nobody was paying attention to that default, then it's going, either it's documented in your system incorrectly, or if you're on the registry, it's going over to the registry incorrectly. So this is something that you're going to want to maintain throughout the year. Assign a user to be able to go through and make sure that these next few things that we talk about are updated, okay? So for the vaccine manufacturers, you're going to come into Setup, Lookup Codes, System Defined. You'll click on Details, and then in the lookup type, you can type in VACM, or you can drop the drop-down and then go to Description and actually type in Manufacturer. And then this same list will come up. So as you see here, all of these are grayed out because they no longer make a certain vaccine or they no longer produce vaccines at all. So this is nice because now it will not appear in the list for my MA or nurse to select from when I'm administering a vaccine, which gives you accurate data in your EHR, as well as if you are on the registry, accurate data is going over. So if I find out that a manufacturer is listed on the CDC site as inactive, I can come in here and I could highlight it, and here in the active, where it says activate, it would say deactivate. And I would deactivate that particular manufacturer. On the vaccine admin sites, I've seen in many sites that they use other if the actual administrative site wasn't listed. But you can add others to that list. Again, if you go to Setup, Lookup, System Define, and then you could type in VAC Admin, or drop it down and type in the description admin site, and your list will come up. To get into these system-defined lookup codes, you do have to have security. So if I had something that was not listed here, I could simply click New, add my code and my description, and it will appear on my list, and it will appear on my list when I am administering a vaccine. So let's take a look at the visual concept that HCN came up with. I've actually talked to a couple centers when I've been on site, and they really like this concept. And I've been working with centers for a very long time, and I think this concept is very, very easy for documentation purposes. So here we have the label. Hep B, PEDS, reported. RV, reported. DTaP, reported. HIB, reported. Okay, and then I still have all my alternates. But when I'm an MA or a nurse, and I get a child that comes into my center that is either come in from a different state or a different country, and they give me this huge list of vaccines that this child has already had. I have to go through and sometimes I knew, sometimes I didn't, of what exact vaccine that they were given. But for reporting purposes, we just need to know that they had it done. So this first line, and I'm going to show you a little bit more when we go through this, when you come into the actual vaccine, to the administration of immunizations, the alternates wouldn't be showing at that point. So as a nurse or an MA, I can quickly look at my list and say, okay, I just have to worry about all of the ones that are indicated as reported, and that is where I'm going to mark all of this child's immunizations that they have brought their immunization record to me. So this is just a sample template that we have. And I highly recommend, because immunizations is such a big project and to maintain the immunizations, what I suggest is you create a template to know, what are we talking about here? We're talking about the DTaP. What CVX code is attached to this DTaP? So when we're talking about reported vaccines, we can use an unspecified formulary. So if DTaP, if you go to the CDC website, it's going to show you all of the different DTaPs and all of the different CVX codes that are mapped to it. It's going to tell you all the manufacturers that are mapped to it. And it's going to tell you all of the vaccine information statements that are mapped to it. So this first line of your immunization that is reported will be using an unspecified. So here on the Hep A, the CVX code for the unspecified formulation of Hep A is 85. I don't have to ever worry about coming in and updating that CVX code for that reported line, because again, it is only used for historical purposes. Everything underneath is what is going to actually be administered to the patient. Okay, so we have our DTaP here, what CVX code you used on that reported one, and then we would list our brand name, our VFC1, and then our combos. Because we want to make sure that if a child comes in and they have insurance, then I want to be able to make sure that I am taking from the proper stock for my immunizations. If they come in and they are not insured, make sure that I am taking from my VFC stock. Not only taking from that particular stock, but actually documenting that I took from that particular stock. So these CVX codes will all be different than this one that's actually reported. Okay, you can say how many times that this DTaP is actually being given. So at 2 months, 4 months, 15 months, and 4 to 6 months. Or 4 to 6 years, I'm sorry. This way, if the person that is in charge, and I'd never ever put just one person in charge of immunizations, I would always have two people. Because if that one person is out and something needs to be updated, you want to make sure that you have a team. Work with your pediatric providers to make sure that what they are looking for on that immunization schedule goes along with what's on the CDC schedule. So the parent label, how you're actually going to go through and create these parent labels is you're going to go to EHR, go to Setup, Immunizations, and then Vaccines. Again, you will need security to actually go in and make any changes to your immunization schedule. So we'll work with the DTaP. So I would go in and I would create a vaccine called DTaP Reported. The CVX code is 107. But I would highly suggest that you go out to the CDC website and print off the CVX codes and the manufacturers for the vaccines that you're going to be creating as reported. Because we're going to put the CVX code, again, that is the unspecified formulary, that is not an active CVX code for DTaP. Okay, so you're going to put reported, DTaP reported here, the CVX code, and the other thing that is very, very important, even if your center decides not to go this route, they want to stick with the immunization schedule they have, that's fine. We're just showing you what we have come up that is the best standards and the easiest way to document immunizations. All of your vaccines that you are administering have to have units listed as ml. And that is for anybody that is on the registry. If you're not currently on the registry and you know that you're moving towards the registry, I would go through, make sure that you add the ml to the units. Okay, then go ahead and save. And then your alternate labels. If you remember, my first one is reported. That's where I'm going to put all of my stuff that's reported. Everything underneath is going to be your alternates. So you're going to have the vaccine name. You're going to have the procedure code. You're going to have the CVX code, which is the valid CVX code, the default manufacturer, the units, and the default funding source. So here, I'm going to put my DTaP IPV HIB, which is the Pentacil. This is where we are stating to put the procedure code, not on the order, but when I actually administer the vaccine, then the procedure code will drop. My valid CVX code for my Pentacil, who actually makes the Pentacil, the default amount, your funding source, and then you can save. If your parameters are set up that once I put in an NDC code, or once I put in a route, or an admin site, or a lot number, or expiration date, if it is set to auto remember, as soon as MA Jennifer goes in and administers a Pentacil, On the immunization schedule, she will enter the NDC number. She will enter the route. She will enter the admin site, the lot number, and the expiration date. The next child that comes in and she does another Pentasil, that information will default when they actually administer that Pentasil. The reason we do not default NDC numbers is for the pure reason that if you have multiple locations, we cannot guarantee that you are getting the same NDC number across the board. Same goes for the lot number. So it's very important, if you do have this stuff, that it is remembering, so it's less clicks for your clinical staff to enter when they're administering, to be very, very careful to make sure that that lot number is correct, to make sure that expiration number is correct, and to make sure that your NDC is correct. The NDC has a lot to do with billing, and your lot number is very important if an immunization was ever recalled. You could actually run a report on that particular lot number. So these are the ones that we suggest that are defaulted. And if you noticed in version 11, your funding sources are no longer the same. So when the staff started administering last Monday, they should have noticed that now when they go to the funding source, and especially if you're on the registry, and I want to make this super, super important for anybody that is on Florida Shots. So, and it's super important for all of the registries, but Florida Shots is now going to, if you put a child that was VFC eligible, so public VFC, and you put their funding source as private, it's going to go over to the registry. And they're going to question, actually the other way, I'm sorry. If you put that they were VFC, you gave them VFC stock, but it actually came from a private, this child was insured, Florida Shots is now tracking all of that. So super, super important to make sure that your funding sources, because these are going over to the registry, make sure your funding sources are documented properly, and the vaccines that are going over are documented properly. So if that child has insurance, you're not taking from the VFC stock, because then it'll go over to Florida Shots. Florida Shots will send you a bill. So another alternate label. We have a couple different ways that our centers are doing this. This is totally up to you how you do this alternate label to indicate how you want the staff to quickly see if this alternate is a VFC or it's private stock. You noticed a couple screens back, it was just the name DTaP Pentasil with no indicators on it. Okay, so I knew what that was for. Now this one, you can select, we have one center, and I hope I get this right. So we have some centers that are marking them VFC, so that it's an indicator to say, okay, I know automatically this child is eligible for VFC, I'm going to give them this particular vaccine. Or we have a few centers that are using a $ which is indicating that this one actually costs money and the other one doesn't. So again, totally up to you how you label it, but please, please, if you're going to label these, whether it's that the vaccine is something that they will have to pay for, or it's a vaccine that is covered under VFC, these labels tend to be long. And as we all know, when we're in the immunization module, I have to hover over it in order to see the entire description. So you can put the $ in front, you can put the VFC in front, totally up to you how you actually label these, but please be very clear to your staff which one is actually for private stock and which one is for VFC. Now, the difference between the private stock one and the VFC one is that the VFC one is going to have the procedure code with the VFC indicator on it. Your other one would just have the regular code on it. Another thing to work very closely with your billing team to ensure that you have all of the codes for your DTaps. And then you have all of your codes for your DTaps that are VFCs. Because if not, you're going to want to add them. And if you're part of the RCM, you're going to want to make sure that you get a list to the RCM team to go in and add these codes for you. Because we don't want to add a regular charge to a VFC vaccine, then the parent is going to get a bill for a vaccine they shouldn't have been charged for. Okay, again, we just want this to be, we don't want the nurses and the MAs to really have to think. We definitely want them to think when they're drawing the immunizations and giving them. But when it comes to documenting, we want to make it very, very simple to say, okay, this alternate is one that we charge for, this one is the one we use for VFC. And ensuring that you still have the same funding source. This one's public VFC. We have our units, our manufacturer, our CVX code, which is our valid CVX code, our proper VFC procedure code, and then however you're going to indicate it, that it's either VFC or non-VFC. In just 1 minute, my screen is hesitating at the moment. I apologize. Just trying to catch up. Okay. So let's talk a little bit about creating schedules. As I mentioned before, you want to be very, very careful not to go in and start editing your current schedule that you have today. Best practice is to come in and create a whole new schedule. So as you're working on this schedule, it is not interfering with your clinical staff actually administering and documenting the vaccines that they need to give during the day of the clinic. So you would come in to the immunization setup, and it would show you all of the schedules that you currently have. I would click on New. Maybe my description would be Pediatrics 2017, because I know that's the year that I created it, in case you have to maybe create another one down the road. Totally up to you how you want to name it. And then the type of the schedule. There are recurring schedules, there are age-based schedules, and there are interval schedules. So a recurring schedule could be, I get my flu shot today, and a year from now it's going to be due again. An interval schedule is going to be, I get a shot today, but not at a particular age, and that next shot is due in 3 months. And then, of course, your age-based is, of course, around the different age groups. So you would pick the type of schedule. This particular one, we're going to be doing age-based. And then the default diagnosis for posting charges. There is a few different places I'm going to show you that you can default the diagnosis for the immunization. So when your clinical staff is administering the vaccines, it's automatically going to attach a diagnosis to that vaccine. And then you go ahead and click Save. Again, I listed the different types of schedules: age-based, recurring, intervals. So when you got off this training and you went to start doing something, or next week, just gives you a little bit of information about each one of the schedules. Before we were actually on, when we were creating the schedule, it asked if we wanted a default diagnosis on it. This is where the default diagnosis is going to appear. So once you start building out all of your vaccines, no matter what vaccine it is, this is the default diagnosis and counter for immunizations that we'll go over with the charge. Now, when you create a brand new schedule, you will not see all of the age groups that were created on a previous schedule. So if you are going to create a brand new schedule, I say garbage in, garbage out. So start fresh, create a brand new schedule. I would recommend going and looking on either your other pediatric schedule or going by the CDC and then start adding in your age groups. Remember, this is for, you're working on a child immunization schedule. So you'll put all of the age groups for that particular child's range. So the description is what the description will appear here, and then the starting age is 1 month. You go ahead and hit save. I would go through and add all of your age categories for your pediatrics first. Then what you're going to do, once you have all of your age groups, you're going to still be under that schedule, but now I'm going to click Add Vaccine. So when I add vaccine, remember we were talking about the schedule, that the report is always on the parent line. So I would add my DTaP reported, which I added before because I didn't have it as a vaccine. Now, you can change these. You don't have to, but default days, scheduled date that the dose is considered due. So in your schedule, when you're looking at the immunization module, it's either yellow or it's red. So if you put 1 day, if it's for a year, the child gets it, I don't know, once a year. I say it's due 1 day before that. Then it's going to show due 1 day before the actual date. Same thing when is this dose considered overdue? If you want it to set 1 day after the 366 days, then it will show overdue, but you can just leave them as 0. And then it's going to follow the age group, so it's going to know when that child is a month old. So when that child turns a month old, it's going to be due. The day after that child's 1 month birthday, it's going to be overdue because they didn't get it done on their birthday. So we have our reported, which is our parent line, and then we're going to add those alternates. So when you click on Add Alternate, you're going to look for all of your vaccines that include DTaP. If you notice, I have my Penticil, my Kinrix, my DTaP Hib, Pedirix, Infarix, Daptocel, DTaP. And these are actually full alternates. This confuses people all of the time. When do I pick full alternate versus partial alternate? So when you have your schedule and you have a DTaP and an IPV, and then you have an IPV, I don't want to have to go into every single one of those line items and mark that that child had all of those vaccines. So when it is the DTaP and IPV, that's full. It's part of the DTaP. So it will go in and it will mark all of those appropriately. Let's say I had a MMRV, measles, mumps, rubella, varicella, as reported. And my alternates were MMR, because MMR is actually part of an MMRV. And then I had my MMRV. My MMRV is going to be a full alternate. But my MMR is going to be a partial because it does not include the varicella. Okay? So go ahead and mark them. Most of the time, I've seen it with the MMRs and the MMRVs, but most of the time, these are full alternates. Once you have all of your vaccines, your alternates selected, go ahead and hit save. Once I hit save, I'm going to have my parent line, and then I'm going to have all of my alternates that will show up underneath that parent line so that I can actually administer whatever vaccine I gave, Daptocel or Pedirix, whatever one I gave. Okay? So once that all displays, you'll go ahead and hit save. And then my screen is frozen again. I apologize. There we go. So now you'll see that we have our DTaP reported, and then we have all of the DTaPs that I used as my alternates underneath. What you'll do is on your reported line, you'll select the appropriate age that child needs to have that particular vaccine. Okay? Do not need to do that on every single one of these. On the Imferix, on the Pentosil, you do not have to put check marks on those. Just put it on the parent reported one, and these will follow. Okay? So what you're going to do, what I would recommend you do, create all of your age groups first, and then create your vaccine schedule. And then you can come in, once all your vaccines are here, you can come in and work with your pediatrician and or look at the CDC website and put when these are actually recommended. Once you've done all of that, you can hit save, and your pediatric schedule is complete. So another thing I wanted to show to you too is when you're actually in the immunization setup and you're on the schedule, I could actually right-click on here and add another alternate. Maybe I look at my schedule and I'm like, oh, I forgot one of these. Right from here, I can right-click and add an alternate. I can right-click and I can edit the vaccine. I can remove a vaccine. Or I can right-click on it and maybe I want DTaP after HIB. So I can move these up and down. Problem when you move them up and down is it only moves it once. Then you have to right-click on it again and move it again. So some centers like to have it in alphabetical order. Other centers like to have it the way the CDC lays it out, because a lot of centers that I've worked with, they actually have the CDC printout schedule. And clinical staff is very familiar with that schedule, so they like their schedule to map with the CDC, or to match it, I'm sorry. So again, you can just move these up and down as you see fit and how you like your immunization schedule to display. So as you see here, this is my sample schedule. So I have all of my reported here. Because when I'm an MA or a nurse, I come in here, if I'm just doing historical, maybe you do this the night before, you pull all the records and you go in and you add these historic shots, if you can obtain the records. I don't have to show alternates. My list is much shorter, and I can come in here and I can put the date of the Hep B, the doses, the DTaP doses, the HIB doses, the IPV doses, etc. Because again, these are all of our lines that we're using for historical purposes only. Now if I come in, the patient's here, I want to actually administer a vaccine, I show my alternates, and then I could select the proper vaccine that needs to be given. And here, this is where I want to show you, of course it's a PowerPoint, but see how Pentosil actually gets, you have to hover over it in order for it to see it. That's why you might want to put your indicator, and maybe the $ means that they have to pay for it, and if there is no $, then that's for VFC. Or you could put the $ for the ones that they have to pay for and put VFC on the VFC one. Again, those indicators is up to the center on how they want to indicate, so the staff is selecting the right ones. So I want to talk about vaccine information statements. If you are in the registry, your vaccine information statements should be cleaned out. They should be up to date, because we did that during your registry project. So what I want people to do is I want them just to open a test patient, go in and go into the immunization module and click on Administer. Okay? The vaccines that need to be administered will pop up. You'll go ahead and you'll click on the Add under the VIS statement. Once you do that, this box will appear. This box should be very, very clean with your vaccine information statements on it. I should only have one Hep A. I should only have one Hep B. If you have multiples, first you want to go out and print the list off from the CDC website to make sure that the published date is the right date. Okay? Now, there's two ways to do this. Because everybody already has their VIS statements, you can click on New. You can put in the VIS description, which is this, the CVX code, which you will want to make sure that whatever active code for our DTaP, that this code matches it. Okay? So whatever you have in your vaccine setup for the active DTaP, not the reported one, the active one needs to match the CVX code that's on here. And then you'll put in your published date, and this field is new as of the last version, the VIS barcode ID. So this can also be found on this link. That is the direct link right into the page that will give you the VIS information sheets, as well as it will give you the barcode that goes along with it. Another way that you can do this, and write this down because it's not in this presentation, if I have a Hep A, for instance, or I'll stick with the DTaP. If I have a DTaP listed on here, but this is not the correct publication date, I can click on this, and then I can say copy. So what it'll do is it'll bring in all the information for me, and then I can update it. So I don't have to type it all over again. So I would bring the information in. I would make sure that the CDC code, CVX code is correct. The published date, you would make sure that when you copy it, you put the proper published date in it, and then make sure that the VIS barcode ID is correct as well. Once you've copied it, made sure all the information is correct, you would go ahead and save it. If you come in here and you have multiple DTaPs, some with old dates, you can actually right-click on the old ones and deactivate it. Or you can click on it and then deactivate it. We don't need 5 DTaP VIS statements. It's very difficult for the clinical staff in order to keep them moving and get this information in quickly. We want to make sure they only have one selection. So not only are you making sure that it's correct, but if it's not correct, updating it and deactivating the old ones. So if I go in to that link on the CDC website, it's going to give me, and we'll take this adenovirus for instance, it's going to give me the CVX code, okay? Both adenoviruses are the same. The description's the same. The actual barcode is different. The VIS document name is the same. But if you notice, this one is the historic one, and this one is the current one. So when you come in, because these lists are very long, I mean, if we look at all of the DTaPs, these are all current, but depending on what type of DTaP it is, they have different CVX codes, different barcodes. So be very careful to look to see if it's historic or current. Again, a couple times a year, I would be coming in here. I cannot tell you how many times the CDC decides to change a VIS statement. I don't know. I haven't yet figured that out. They do the same thing for manufacturers. They do the same thing for CVX codes. So maybe every quarter, I would put it on your calendar to go in and make sure, do I have any new VIS statements? Do I have any new CVX codes? Do I have any new or deactivated manufacturers? Because you can use this DTaP right here, and then all of a sudden, they're going to say that this code, the CVX code, is no longer available. You have to use a different one. So it's going to take you a lot to create an update, but you absolutely have to make sure that you're going through and you're maintaining it, especially if you're on the registry. If you do not maintain your schedules, your CVX codes, your MVX codes, and your VIS statements, you will error out on your registries. Very, very important. CVX codes are the same thing. Making sure that you are always maintaining the active one on your alternate immunizations that you are administering to your patients. Remember, the reported one, we don't care. Once we put that reported one there, it does not matter. It is only for historical reasons. There's going to be different statuses on the CVX codes. Again, this link will take you directly to the page that you will need to look at, and this is just a very small section of it. It is going to give you the description, the full vaccine name, the CVX code, whether it's active, and the last time it was updated. So you'll see I have two of the exact same things. Well, this is the same. The CVX code used to be 54, is now 143, and this went inactive on 5/28/10. So if you've been live longer than May of 2010 and you never ever changed this code, this is the actual active code now. So if you had adenovirus on your schedule already, and you are it's no longer CVX code 54, you would just go into your setup, into the actual vaccine itself, look this adenovirus up, and change the code from 54 to 143. Then it will report properly. And my screen is hesitating once again. Okay, so as I mentioned, if you notice, if the vaccine is inactive and now is active, to go into the vaccine and update the CVX code. Okay. Same thing for your manufacturer codes. This link will take you directly to this listing. This is what your code is, what the manufacturer is, if it's active, and the last time it was inactive. Here it will show that Accombus is no longer active, but they were acquired by Sanofi. So you would want to make sure if you had any vaccines that had a manufacturer of Accombus, you would want to make sure that you change them to Sanofi. Again, you could come in to Intergy, setup, lookup codes, system defined, and then the vac manufacturer. And if we know that that manufacturer is no longer making vaccines, maybe it's just not making one vaccine. You wouldn't deactivate it if it's still making vaccines. But if it's no longer making vaccines, you would actually find the manufacturer and click on deactivate. So once you've deactivated that manufacturer, you want to make sure that you come in to the vaccine in EHR and set up immunizations in the vaccine itself and update your default manufacturer if you are defaulting them. Again, if it's not defaulted and your system is set to remember, there will be something here you'll want to update it to the proper manufacturer. Okay, so what I'm going to do now is I'm going to go ahead and stop the recording.